Here's a strange fact. Researchers tested older adults' hearing using real equipment, not a questionnaire, an actual test, and found that nearly 3 out of 4 had measurable hearing loss. But when they simply asked those same people if they had trouble hearing, only about 1 in 3 said yes. That gap between what's actually happening and what people notice is what this whole video is about. Because hearing loss doesn't usually arrive as silence. It arrives quietly, one missed word at a time, until your brain has already started working differently to compensate. Stay with me, because the second half of this video covers something most people have never been told, what hearing loss has to do with brain health, and one simple thing you can do about it this month. Welcome back to Forever Young Health. This channel exists to give you real, honest information, the kind that doesn't just repeat "eat your vegetables," but actually tells you things that might genuinely surprise you. Today's topic surprised me too when I first came across the research. We're going to cover why hearing loss is so easy to miss in yourself, even when it's already significant. The real researched connection between hearing and brain health. And a few simple steps that cost nothing and take 5 minutes. Let me ask you something. Have you ever been in a noisy restaurant and found yourself just nodding along, smiling at what seems like the right moment, hoping it was actually funny and not something serious? Or maybe you've noticed you're turning the TV volume up a little more each year, or asking people to repeat themselves, not because you weren't listening, but because the words just didn't quite arrive clearly. Here's the part almost nobody tells you. Many people quietly assume this is just getting older in a vague way, or worry it's early memory trouble. But often it's neither. It's hearing. And the brain is remarkably good at covering for it, filling in gaps, guessing at words, which is exactly why it goes unnoticed for so long, sometimes for years. Hearing loss related to aging usually doesn't happen suddenly. It happens gradually over years, starting with the higher-pitched sounds, things like certain consonants, a child's voice or birdsong, long before it affects the sounds you'd notice missing in everyday conversation. Because it's gradual, your brain adjusts along with it. It starts relying more on context, lip reading without you realizing it, and educated guessing to fill in the blanks. This adjustment is actually kind of remarkable, fight, but it also means you can lose a meaningful amount of hearing before you consciously notice anything is different. This is exactly why researchers found such a big gap between measured hearing loss and what people reported themselves. It's not that people are in denial, it's that the loss is genuinely hard to notice from the inside. Now here's the part of this video I really want you to hear clearly. Researchers have found that hearing loss is one of the strongest known modifiable risk factors connected to dementia, risk later in life. Not the only factor, not a guarantee either way, but one of the most significant ones we actually have some control over. There are a few theories about why. One is that when your brain has to work harder just to process sound, filling in gaps, straining to understand, it has fewer resources left for memory and thinking. Another is that untreated hearing loss often leads to pulling back from conversations and social situations, and we already know social isolation itself is connected to cognitive decline. Either way, here's the hopeful part. Because this is a modifiable risk factor, it's also one of the few things on this list you can actually do something about, starting soon. Before we go further, let me be really clear about something important. This video is for general education only. I'm not diagnosing you, and hearing loss can have many different causes. Some related to aging, some not, some temporary, some related to other health conditions entirely. Only a hearing specialist or your doctor can actually tell you what's going on with your own hearing, What I want to give you today is simply the awareness and the right next questions. Because so many people go years without ever getting tested, and that's the part that's genuinely within your control. Here's a simple, real-world sign, worth paying attention to. Can you follow a conversation in a noisy restaurant or a crowded family gathering? This is often one of the very first places hearing loss shows up, because background noise is exactly the kind of situation where your brain has been quietly compensating the most. If you've started avoiding noisy places, sitting strategically to hear better, or feeling exhausted after busy social gatherings in a way you didn't used to, that tiredness has a name. It's called listening fatigue, and it's a real documented sign worth mentioning to your doctor. Here's another one, and it's almost universal. Has your TV volume crept up over the years? Not overnight, just a notch here, a notch there, until one day someone visiting comments that it's really loud. This slow creep is exactly the pattern of gradual hearing loss. So gradual that you adjust right along with it, notch by notch, without ever noticing the total change. If someone in your life has mentioned your TV volume, or you've noticed you need captions on now when you didn't before, that's worth paying attention to, not brushing off. If either of those signs sounded familiar, the restaurant, the TV volume, that's exactly why this video matters. So go ahead and hit that like button. It genuinely helps this reach someone else who needs to hear it. And here's a real question for the comments. Has anyone in your life ever mentioned your TV volume, or have you noticed yourself avoiding noisy places? I'd love to know I'm not the only one who's heard this from family. If you know someone who might be quietly dealing with this, a parent, a spouse, a friend, please share this video with them. Sometimes hearing it from a video is easier than a family member bringing it up directly, and if you're new here, subscribe to Forever Young Health. We cover real, research-backed topics like this every week, made specifically for adults 60 and up. Okay, let's talk about what you can actually do. The fix, step 1, get an actual hearing test. This is the single most important thing in this whole video. A real hearing test, not a self-assessment. Remember the gap from the beginning of this video. Nearly 3 in 4 people had measurable hearing loss, but only 1 in 3 reported it themselves. That gap exists specifically because you cannot reliably self-diagnose this. A hearing test takes about 30 minutes. It's painless, and many audiologists or hearing centres in the US and Canada offer a baseline test at low or no cost. This isn't about jumping straight to hearing aids, it's simply about knowing where you actually stand. The fix, step 2, mention it to your doctor. Even if you're not sure, you don't need to be certain something's wrong to bring this up. At your next regular checkup, it's worth simply saying, I'd like to check my hearing, just to have a baseline. This matters especially if you're also noticing any memory or focus changes, because sorting out whether an issue is hearing-related or something else entirely is important, and hearing loss is one of the more fixable pieces of that puzzle. The fix, step 3, if you're a caregiver or family member. If you're watching this because you've noticed these signs in a parent or spouse, here's something gentle worth knowing. Bringing this up can feel delicate, because hearing loss sometimes carries an unfair stigma, almost like an admission of getting old. A caring way to open the conversation is simply sharing this video or saying something like, I read that a lot of hearing loss goes unnoticed. Would you be open to getting a quick baseline test with me? Framing it as something ordinary and preventive rather than a big diagnosis tends to go a lot further. A gentle real talk moment. I want to say this plainly. Needing a hearing test, or even eventually needing hearing aids, isn't a sign of decline. It's simply maintenance, the same as needing reading glasses or getting a cavity filled. there's sometimes an unspoken embarrassment around hearing aids specifically that doesn't exist around glasses, and it's genuinely worth letting go of. The research is clear that addressing hearing loss early is connected to better outcomes, not worse ones. This is one of the most encouraging, actionable pieces of health information in this whole video. Bringing it together. Here's everything from today in one place. Hearing loss is often invisible to the person experiencing it. That's not denial, it's just how gradual change works. Struggling in noisy places or rising TV volume are real. Worth mentioning signs. Hearing loss is one of the strongest modifiable risk factors connected to brain health. A real hearing test, not a guess, is the only reliable way to know if you're a caregiver. Framing this gently as routine maintenance helps. None of this requires a diagnosis today, it just requires one appointment. Of everything we've covered on this channel, this might be one of the simplest things you can actually act on this month. One test, 30 minutes, no guessing involved. If this video gave you or someone you love something worth checking, that's exactly why I make these. Thank you for spending this time with me today. Take care of yourself, and I'll see you in the next one.